Even if it's next time. Okay. All right, Stephanie, can you tell us what life had been like on a day-to-day basis before you started the TruDenta Therapy?
Life before I started my therapy was a struggle every day. It's kind of hard to, be able to interact with my kids because I always had that, feeling in the back of my head, what if they kick me in the jaw, which happened many times. Hard to kiss my husband when you get negative reinforcement. When you're trying to show affection to somebody, it's a little bit rough, and you don't want to do it all the time. When I've gone to a doctor, and he had mentioned that he wanted to do a jaw replacement, and at 35 I wasn't quite ready for that. I wanted to explore some more options, and of course it wasn't covered by insurance because they don't want to fix a jaw that's pre-existing, or clauses and all that exciting stuff. So I decided to talk to a friend of mine that actually referred me to Dr. Malin, and I'm sure glad she did, because I'm experiencing some happiness now. So.
Okay. And how long had you been dealing with this? Or do you notice any triggers that set it off? Did you have any, what other treatments did you try before? Did you have MRIs? Did you have, what were some of those results on those?
So other treatments I've explored. I noticed after I had gotten my tonsils out back in June of last year is kind of when it triggered it. As a child, I had some clicking, but nothing really too substantial that was limiting me from eating or talking or anything like that. So so I went to the doctor. They did an MRI for me, and of course I have arthritis. I'm actually out of joint right now. It's really painful and uncomfortable. It's hard to, talk and eat and, do all that stuff that is, you need to do for your life. And so he did a Kenalog shot when I went to the office once, and that didn't do anything. No pain relief at all. It was just kind of it just hurt where the site was and where he had injected, and it was not a great, result. So I didn't like that. And then he was going to do a little clean out, which of course the insurance didn't cover, and those aren't always successful. I mean, it could make it worse, it can make it better. They didn't know. So I was like, do I want to take that chance and spend that money if I know I'm not going to get any result? So that's when I was referred to you, and here I am.
Okay. What things had you tried to do to deal with the pain? Did you take anti-inflammatories? Did you take narcotics? What kind of medicines and treatments did you use?
Ibuprofen. I would take the 800 milligram ibuprofens to take the edge off. Those are the kind of medications I would take. I wouldn't take any narcotics. I don't do well on the heavy stuff. It just makes me a little dingy and, more than I already am. So it's a little bit hard to want to feel that way. So I did have a mouth guard that I wore at night that, I wasn't really good about wearing all the time. And so it caused more harm than good. And it caused me to have more pain. So.
Okay, on that one, I'm going to ask that one again, just so you will state it
better.
Just
what other narcotics I took.
Yeah, or what other treatments or what things you use. So
what other methods?
Yeah.
Okay.
So, what things did you try to do to deal with your pain? What drugs or methods?
Methods I would take to deal with my pain. I would take ibuprofen 800 milligrams. That would take the edge off. I did the night guard I got from my dentist, and that almost made it worse because I wasn't very vigilant in wearing it and sticking to it, because it didn't always bother me until I had the tonsillectomy. So I don't like to take any medications that make me dingy, because it's just normal me. So didn't want any more to do and to add to that. So
okay, what was your experience when you first came into Dr. Malin's office for a consultation on TruDenta?
My first experience when I came in was just one of hope and just know that I could get some relief from pain. I automatically felt like they were here to help me, and they had faith in what they had to offer me, and just an idea that I could live a little bit of a better life with less pain, and hopefully get back to the normal everyday life that I live.
When did you first start to notice improvement or relief from your symptoms?
The first time I noticed relief and some relief from my pain and symptoms, I would say after that first treatment. I mean, just the massage just kind of de-stresses you and makes you feel, like you can just keep going and, relax you enough to, not be so uptight and clench, and just kind of relax a little bit, and just kind of get that feeling that, okay, they're here to help me, and I should just do everything I can and do everything I can well to get the result that I want to get. So,
how did it make you feel when you saw that there was some relief and you knew that this might help with your quality of life?
Say it again.
Okay. How did it make you feel after your treatment to know that this could help or give you a better quality of life? How did it make you feel?
After my treatment, it made me feel like this was going to be a step in the right direction to being able to, go about my life and taking care of my family, and being able to do that with less pain and with more, hope that it's going to get better. And I could, as long as I did what I needed to do and, was vigilant in doing what I was asked, I could have a better quality of life.
How is your life starting to improve since starting your therapy?
My life has started to improve since the therapy, by just being able to function just normally, and not having to take a pill just to eat, or just, being able to eat food that I could chew. I mean, I try not to, eat too much stuff that requires a lot of chewing, but just even being able to kiss my husband without pain, and being able to just play with my kids and not feel like, they feel like they can't have fun with me because they don't want to hurt me.
What would you say the most dramatic difference in your overall experience after having therapy? So your most dramatic difference.
My most dramatic difference after the therapy has been just the pain. I mean, when I came in, I was at a 9, and now I am at a 4 easy. I mean, it's the change, and the pain has gone way down, and it's been a wonderful welcome change, because I'm an active person. I like to go do stuff and be active, and it's hard to do when you're in pain all the time. So to have that relief and have it to where it's tolerable, it's much a welcome change.
How do you feel about your care while coming to Dr. Malin's office for treatment? Is it something you look forward to, or is it something that like that has been an inconvenience at all, or is it that kind of thing? So how do you feel about your care while coming into Dr. Malin's office?
My care coming into Dr. Malin's office has been fantastic. We have so much fun, and that makes it all the better. Just to come in and look forward to seeing the people and seeing him, and being able to have fun with him and joke around, and just feel like I'm important to somebody, and that they care that I'm in pain, and that they take that into account. And just the whole office is fantastic and very welcoming, and it's just a place that you feel like you're comfortable, and you can just be yourself.
Okay, would you recommend this therapy to others who may be suffering with similar issues as yours?
I would absolutely recommend this to somebody. Actually, I have to a couple of people, and I'm hoping they come in and can get the same results I've gotten, because it's wonderful, and it is definitely life-changing, and it's so much fun to see the difference between what I was and what I am now. And I want that for people, because it's hard to go through it, and you want to share that with people that struggle with maybe the same problems.
Okay, I think that's gonna do it for right now, and I'll